My name is Mohamed Saleh. I live in Connecticut, US, and you know, starting my career, it's been fun. I'm a father of two girls. I'm happily married for a little over a decade and a half now, and when I first started my career, I started in aerospace, working for a division of Boeing. And it's been such a wonderful journey from where I started and where I am today. I started off making seats for airplanes, and early in my career, I was introduced to someone who was working there as a physician who kind of introduced this concept of transferring what I've been doing at Boeing into healthcare. And so this is a little over around 22 years ago. I decided to take that leap of faith, and I moved into healthcare to really see if I could apply this modern management system that I was using or learning there, and move it over to healthcare. And initially, I said it wasn't applicable. And then the more I got into it, I realized there's a big difference between traditional management and modern management. And at that time, this modern management was really taught to me by what I would call senseis or teachers from Toyota. And so it opened my eyes to a lot of things. But one of the things that early in my career I wasn't really exposed to is getting leadership buy-in, because that individual that brought me over to healthcare was the CEO. So he was already bought in. It was and really he sparked this purpose in me of helping patients. And he only had 8 clinics at the time, and we were able to grow this organization from 8 clinics to 32 clinics in under 4 years. Well, that required a lot of things underneath it, and I learned a lot at a very rapid pace around how to acquire medical groups, how to create a franchise-like model, how to develop operating systems that could be sustained, and then from that, we were brought up by a healthcare hospital who was watching us very closely and wanted to transplant those ideas into healthcare or hospitals. And so he ended up, that CEO of the hospital ended up buying our medical groups, and I moved in. And at that time, it was another big passion of mine because my first assignment was to focus on our cancer patients and streamline everything from the moment they start all the way until they heal. And my father at that time was going through chemo himself, so it was a very personal thing for me to try to redesign the continuum of care of what I saw his challenges were, and so I wanted to make sure that that didn't happen to other people. And so I moved into that, and we were doing our first alliance with Memorial Sloan Kettering at the time. And over 2.5 years, it became very successful. I started overseeing the entire transformation of the healthcare system of 40,000 employees. We were 7 hospitals, and at that point, we were growing very, very fast. We had behavioral health, we had home care, rehab, skilled nursing facilities, everything in between. And so as that happened, my scope got bigger, and I managed a team of 30 practitioners who were both assigned to presidents of each hospital or each region, and then they had facilitators or practitioners underneath them. And I led that transformation for 12 years. And they grew significantly. When I first started, there were 8,000 employees. When I left, there were 40,000 employees. So the system grew significantly, and it became known for two things: how strong their operating model was, and the culture that was created. And it really stemmed into leadership practices and behaviors and purpose. And so that became my new calling. And I noticed that there's a lot of healthcare systems around the country that are struggling with disengaged people, disengaged workforce. The workforce is burnt out. You have some of the most brilliant physicians I met in my career And I started my entire career working with physicians, so I have a soft spot for them. But I found out that, or I noticed that it had evolved into that they became these widgets, and the purpose of why they do medicine wasn't there anymore. And so it became a mission of mine. How do I bring joy back to them and what they do? And that's been my passion since 2019. And I've been focusing on burnout. I've been focusing on disengaged workforce. I've been focusing on employee turnover and why would people even leave and not want to be in this organization. And also just like the front line is burnt out, and so is the leadership team, and they can't meet their goals. They have 30 initiatives that they're working on, and they get nothing done in the end of the year. And so that became really a focus on how do I redesign their operating system? How do I help redesign their culture so that I could emulate the successes I've had in other practices before? And so early, while I was still employed at this healthcare system, I started a consulting company, and that consulting company was established in 2008. And so and since 2019 that I kind of moved into that space as an executive advisor, and now I help healthcare systems do that. So that's my professional side. My academic side, I've been a professor at 4 universities for the last decade and a half as well. And I teach lean management there. I teach project management. I teach operations management. I teach strategy, and I teach organizational behaviors. And my doctorate has been focused on understanding that every healthcare system is different. It's not a cookie cutter approach. I don't have a customized framework that I go from one system to another and just kind of deploy it. I don't install operating systems. I try to understand the context that I'm working with and then mold that to what they are doing. And I help understand what their strengths are and kind of elevate that, and then understand where their weaknesses are in their systems and help redesign that with the many factors that impede or accelerate these transformations. Um, I have my doctorate is from North Central University out in California, and I also have an I got my executive program from MIT around mastering negotiation and influence. And so my wife would introduce me as a recovering mechanical engineer. Well, my passion now has really fallen into the healthcare space and really seeing what can I do for patients, what can I do for physicians, what could I do for the workforce to really help both the leaders and the front line really find purpose in what they do.